Good morning, ladies. It's Carol Laurie, and this is October is Breast Cancer Awareness Month. But for you, it's not a 1 month moment, right? Something that you deal with 24/7. And because of that, you need a lot of extra support. And I am committed to bringing you only the best of the best. And that's why I have my dear friend and colleague, Dr. Mary Elaine Southard here. And Dr. Mary Elaine, let's just call her that, is so esteemed in her experience. She's going to give you more details, but welcome and thank you for spending time with me and my community.
Thank you. I'm honored to be here, Carol.
So give people, women, a little bit of a background, because when I wrote your post, you have so many different areas that you've been doing this a long time, and you're very elevated in the profession.
Well, thank you. Well, I've been a nurse 45 years, and it's interesting how one gets in a career trajectory, if you will. I graduated from college and went and worked at the University of Pennsylvania and was thrown into oncology, and it became my love. And the reason is it is a vast area of specialty that requires you to stay constantly updated, and that in itself, as well as being empathic and wanting to really be a voice and to be someone to be an advocate for people, it drew me in. So I went on to get my master's in adult health and illness at the University of Pennsylvania.
Yay! My hometown.
There you go. And became a clinical nurse specialist. And in that role as an advanced practice nurse, I saw thousands of women
Literally
that had been diagnosed with breast cancer. And
literally thousands. Let's just take a moment. Thousands. Right?
Yes. And so I proceeded to do genetic risk assessment and participated in that endeavor and helping women. So I would see women from the path, getting the path report, explaining it to them, helping them through the transition of understanding the diagnoses and the treatment plan, and through the treatment journey, and all the way through, unfortunately for some, through terminal care. So it really is a journey. And it's also, I was thinking about this earlier, advocacy. We hear so much today about you need to have an advocate. And I then got into what's called nurse coaching, because I believe that helping people become their own advocate and how to get there is really the true key for women to make the right decision for themselves regarding their treatment.
Well, you're not going to have any disagreement with me there. And I want to start even back from the very beginning, because when women come into my program, many women don't have a clue what their pathology report says, which I find very disturbing. And like you, I believe that education is knowledge, and knowledge gives you empowerment to advocate for yourself. And you need to have both in order to talk to your oncologist about treatment options or testing. So understanding your pathology report is the first clue, because women come in and they go, I don't know, it's a bunch of letters and numbers. And I don't think that it's not their job to really teach themselves. It's someone like yourself or the clinicians, the oncology office, to make sure at the very beginning the woman is educated. So let's talk about what advocacy means and what it looks like, and how someone such as yourself really helps women navigate the system, which is, it's like putting me in front of a Tesla car, opening up the hood and say, well, here's a piece of paper. Now you can fix the car. It's like, right. Really? I don't think so. Right.
Well, I think, just to back up a bit, I think one of the main issues is that women don't know that they can get a second opinion on the pathology. And that is like a novel idea for many women. They don't, and I think it's really important to do that. having said that,
Why is it important? Wait, why is it important a woman get a second opinion?
Well, as we all know, there can be misdiagnoses.
Right. Or misinterpretations of certain numbers, right?
Correct. And so to really dive down and to understand and to make sure that that is the correct diagnoses, I think it's really important for women to understand that that is an option for them. There's so much information coming at them from the get-go. And, taking a step back and realizing they can get a second opinion on the pathology, I think is first and foremost. The other issue is women don't know what questions to even ask for the most part. And my role as the quote unquote expert in residence was to really help them be able to articulate the questions that they want to ask in a systematic way, in a compassionate way, and also get those kind of responses in a systematic, compassionate way. Because I think, as I listened to a TED Talk yesterday about compassion in medicine, we're missing the boat. So I think taking that step back and taking the breath and putting it in some type of context for people, so that there's not this rush of emotion to make decisions based on emotion and not based on objectivity, is really first and foremost.
I think it needs to be a fine line between having the foundation and understanding what the oncology medical component is, and then really taking a step back and tuning into your body. I think that is different than just saying, no, I'm not doing this. I mean, we need to, I talk to women all the time. Like, I just had a woman who opted out of tamoxifen and AI, and now it's a year later and it's come back. And she said, well, I don't want to do that. And I said, well, we need to pay attention to the clues. Sometimes, which is a big statement of mine. I love that statement, because sometimes if you have a very non-aggressive cancer and you're doing intense integrative protocols, you can, make up that 3%. But if you have an aggressive cancer, it's very difficult to do that with natural methods. And I'm a firm believer in natural methods, but I'm also a firm believer in doing everything, taking the best of both worlds. And there is something called, you don't need to take the drug as often as they're mentioning it to you. You can, talk to your oncologist about reducing the dose, but you're still getting the benefits. So we need to begin to encourage women to step out of the box a little bit, right?
And I think when a treatment plan is so, when it's not personalized to the individual, that's where the misstep is. And I also had a patient who had a very extreme reaction to Taxol, which is a chemotherapy drug given for many cancer patients. And she was supposed to get, pardon me?
She almost died. She had like an allergic response.
She almost died. She had a hypersensitivity reaction that was so intense, she almost died. And, sometimes the treatment plan says, well, you need to get 5 doses of this, but your body's telling you, no.
Not going to work for me.
This conversation needs to be more in depth with the oncologist rather than pushing yourself through. So I think I also had an oncologist say to me, I want you to talk to this patient and talk them into the treatment plan. That's not my job. I can obviously educate them, and I can certainly explain the risks and benefits, but I can't talk someone into something. And so I think that, you alluded to, or you talked about that inner guidance. Part of what coaching does is getting people more in tune with that, so that their decision is coming from a place of not only authenticity, but authority and own advocacy. And that to me is true healing as well.
So this is an important, I agree with you 100%, as always. Mary, Elaine, and I always agree about everything. That's what makes us so great together. But I think it's very important when you make those decisions that you stand firmly in them and realize that that was the right thing for you. And then if there's a problem, 2 years, 5 years, 7 years later, you don't look back and think, oh, I made the
Right.
wrong decision.
But again, I think even using the term problem, because I look at it like, okay, so here you are with a health challenge, but let's talk about the power in the present moment. Let's not look back. Let's not look forward. Let's help you look at the power in the present moment with the information that has been garnered for you, because what, to your wonderful benefit, and I've said this to you before, you have synthesized the information so succinctly for people that, and it's a lot to take in still, but the power in the present moment requires that staying in that lane. And I think that sometimes when we're wobbling, I was meditating one day and I thought about kind of riding the wave, because I counsel and coach a lot of women that have mental health, behavioral health issues as well. And we talk about riding the wave and what that really means. Well, how can you ride the wave if the paddleboard beneath you isn't solid either? But if you feel that you are on a solid paddleboard in those decisions, then you're good, because you can ride that wave.
I always refer to a day sometimes, and in my free masterclass, I have this photo of the wave, and I have all this word on it about empowerment, these phrases about what it means. And the key for all of us, whether we have a chronic disease, which is what breast cancer is, it's a chronic disease, chronic diagnosis, chronic illness. Whether you have that or not, is we always want to be at the top of that wave. That's what we aim for. And there are moments where you get sucked in and you feel like you're drowning, and we all have moments like that. So what we need to learn to be empowered women as we mature in age is, number one, what are the buttons that will suck us underneath the wave? And number two, what are the tools that we have that when we're down there, how can we get back up? And there's a lot of sucking your energy down the wave challenges when you have a diagnosis and treatment and recovery from treatment with breast cancer. Right. So you need a little bit more help than what the standard American advertising messaging is you're sitting there and you're depressed and the house is a mess, quote unquote, and you're taking a pill for an antidepressant. The next thing you know, there's no dishes in the sink. So I have dishes in my sink and I'm not depressed. I mean, look at the messaging of that. Or, a woman's depressed and then she's feeding the family a picnic lunch in the next moment. It takes more than an antidepressant to be able to stay at the top of the wave. And that's what Dr. Mary Elaine is here to talk about. And it's what my, life coaching program offers also. So the fact that women are in the group and watching this, and we'll watch it later, is a testament that you all realize that, right?
Mm-hmm. For sure.
So talk about, what does it look like, the reality of working with you as a oncology nurse coach, which is such a wonderful title?
Well, clients need to look at all the information that's coming at them. Information is power. We know that. And educating yourself regarding your diagnoses and your treatment options is extremely important. However, it can also feel like a tsunami because it's too much information and I don't know how to approach this. And, maybe I've plateaued in making decisions. And as I've said before, we as humans are all creatures of habit. We make this decision on January 1 that we're going to do X, Y, and Z, and make a resolution. And what happens, 2 weeks, 3 weeks, maybe a month later, we're back into our old habits. And so, I think when someone is diagnosed and they come to the realization that they would like to make some real changes in their lifestyle and in their life approach to health, they may have these moments of questioning, doubt, uncertainty, plateau. And so that's what coaching is able to help with, to bring people along, to stay on the path as well. Because it's a journey that we walk with people, and help them with that. And so coaching is very rewarding because the expert is really the client, not me. I mean, I may have a lot of education, and certainly tap into that when I need to. But the ultimate healer here and the ultimate person with the expertise is the client, and helping them realize that.
That is not the message you get when you go into the oncology ward for your infusion and you meet with the doctor. And I have a white jacket in my closet, by the way. Do I need to put it on? I always say that to women. I have a white jacket. I'm sure you do too. Should we go put it on? Will that give us more authority? I think that we're inbred from a very young age that if there's a doctor, and often it's a man, that they're wearing a white coat, we give up our authority about that as women, and they come across as very authoritarian, as opposed to, well, we're having a conversation and let's give you enough knowledge so that you can make the right decision. And would you like a second opinion? I would encourage you to get that, because we want to make sure that you're getting the right decision for yourself. And so many times I'm very alarmed because not the right tests are even being run. Somebody has a recurrence, and the biopsy sample should immediately be sent to Neogenomics or Caris Molecular Intelligence. Rarely is that done.
Right.
That's life-saving information there, everyone who's watching. You have a recurrence, it's medically indicated, it will be covered by your insurance. Don't let the doctor say, oh, you don't need that. You have a right to that.
Absolutely. And I think I've mentioned to you before, I had an example. I had a client years ago, 76 years old, newly diagnosed breast cancer. And I went in to speak with her, and she said, I'm 76. I'm really comfortable with my decision to have a mastectomy. And I don't have this attachment. I'm ready to have the surgery. So I went in to see her the next day, and she was in a puddle of tears. And I said, what happened? And she said, the surgeon had just been there and caught her in a moment of emotion and sadness, and said, what would you rather do, lose your life or lose your breast?
I was just about to say, surgeons are best when they're with a mask on and the person's asleep.
And so,
oh my goodness,
it was to be able to help her process all of that, is just, that's traumatic, to have a surgeon that you put your trust in to verbalize that to a woman. And so, it should be done with finesse, and it should be done with consideration, and a not just a surgeon, a physician, any practitioner, any provider should say to a client, if at any point in our conversation, if you don't understand something I'm saying, please stop me, and we will go back over it. And I remember being at the nurse's station one day, and an oncologist comes out of a patient's room, and I said to him, go right back in there. He said, what? I said, she did not understand one word you said.
A word you said.
So ladies,
this is important for you. Don't give up your power to the doctor and think you can't ask questions. If you don't understand something, this is a life important moment. Just say, excuse me, I didn't understand that. So when I talk about cancer, needing sugar, loving sugar for the gas tank, I don't talk about the Warburg effect and the ATP and the anaerobic glycolysis. I phrase it like, when you eat sugar, you're giving the cancer gas tank gas, and it's very expensive. Right now in California, it's like almost $7 a gallon. You don't want to be eating sugar to feed the cancer gas tank. You have a right to be able to understand what the doctor is talking to you about. And why should you think that you go in there and you understand medical terminology when that isn't your wheelhouse? I don't know how to fix a Tesla, and I never want to know how to fix a Tesla. You need to understand about your breast cancer, and you have the right. So what Dr. Mary Elaine just said is really important. You're in an office, they're wearing a white coat, you're a little freaked out. One of the things I recommend is to always bring somebody with you to take notes, because you're too overwhelmed. When I accompanied my dear friend through her 18 months of breast cancer journey, I was the advocate and the nurse taker, and we're both doctors, so we understood. But every now and then I would raise my hand and say, excuse me, I don't understand that.
Right. And just to kind of go back, I worked in this position as a clinical nurse specialist for 20 years. And at the time, they were eliminating positions, those type of positions within hospitals. And so my position was eliminated abruptly. And I had run a cancer support group for years and really had done a lot in the community as well as in the hospital. But really the universe it's interesting when you allow yourself to be open to things. I wasn't really happy in the position I was, because like you, I really believe that there were more options for people than traditional medical care. And so I went back to school to be a holistic nurse practitioner at NYU, and had worked within the city and taught nursing at NYU. And so I had a very different purview, because I opened and had a more expansive, I believe, approach and to not only healthcare, but disease, and then went on to get a doctorate in integrative health and healing. So, it's really having a foot in both worlds, because I truly understand traditional medical care from my education at UPenn, and also really look at a very different approach than traditional medical care currently embodies.
That's the best of both worlds. That's really beautiful. So, how do women reach you? And before you get into that, like, any words of wisdom more than what you've already shared, which is a lot? Like, what are some things a woman can do? I hear this all the time. I'm talking to women in my complimentary calls, and I always hear, I'm overwhelmed, I have horrible side effects. My quality of life on these drugs is the pits. How do you give women hope, and where do they need to start outside of working with me and you?
I concentrate really on a few, I think, constructs, if you will: self-appraisal, determination, and negotiation. I think as women, we don't tend to self-appraise in the sense that, what is working, what is not working, what do I need to change, how do I do that? Then what level of determination am I at, and how can I change that? But the other key is negotiation. I believe that negotiation can happen with providers, but they need to understand that your side effects are real. And they're not in your head. And I had a client who had extreme side effects. And, when the physician didn't want to, unfortunately, deal with it anymore, he sent her to me. And I don't like labeling patients. I think that that's, not only irresponsible, and she was labeled non-compliant because she wasn't taking her medication.
Oh my goodness.
And I said, well, let's just start from the beginning. Keep a log when you take it for 3 days. And if the drug is bringing you that much, because there's a pattern, and we help people find the pattern. And then you show that to the physician and you say, this is my pattern. This is what happens. And this is why I am choosing not to continue with X, Y, or Z. There's power to that. There's data to that. You are the N of one. And that in and of itself, I think is powerful.
I think what's really important, and I say this in support of what you said, that if you go into a doctor and you're having side effects or you don't feel well and they go, well, let's give it a couple months and see how you feel then. They are not the people who cannot get out of bed, that have horrible muscle aches, that have that you weren't depressed before and now you're depressed, that you've just spontaneously gained 50 pounds, that you're aching, that you can't get off the couch and you want to die because you're taking this pill. They are not the person that has to last another 3 months until you come back in to see them. So please do not let that be an appropriate response. As Dr. Mary Elaine said, your pain is real. And if they're not listening, the only thing to say is, if you're not taking this seriously, I need to see someone who will, because I'm not making this up. I'm not crazy. This is a known side effect of this medication. Now I need to be referred to a different doctor. Fire the doctor. I mean, do not put up with being diminished in your reality. That's not acceptable treatment, right?
Or in your feelings, because people's feelings are valid, and it's not anyone's job to negate them in any way, shape, or form.
100%. Love that. That's empowerment. Okay. So once again, how do people reach you?
So they can reach me one of two ways. My website is Dr. Nurse Coach, NEPA, which stands for Northeast Pennsylvania, which is where I live.
Yay. It's up in front of us
Dr.
now.
Nurse Coach, NEPA. And my email is mescoach@AOL.
Okay, but I like this, Dr. Nurse Coach, NEPA, Northeast Pennsylvania, yes, .com. And the website is in front of us right now, and we'll stay there. And now I'm going to put your email. That's Dr. Mary Elaine's email. Thank you for taking time and being here, and I really, really appreciate it, your expertise. For those of you who need coaching, I highly recommend Dr. Mary Elaine. She is esteemed in her community. She knows what she's doing. And she has, very rarely do I meet somebody who has more years than I do. I'm at 36. She is 45. I'd say that we're, when you've passed the 15-year mark, you begin to be an expert. But when you pass the 20 and 30-year mark, you are really an expert. And Mary Elaine is very much an expert. So thank you very much for being here.
Thank you so much. And I would just like to leave everyone with a short prayer that the Dalai Lama says every morning. And I have used for my nurses that I try to help them with. May I be a guard for those who need protection, a guide for those on the path, a boat, a raft, a bridge for those who wish to cross the flood. May I be a lamp in the darkness, a resting place for the weary, a healing medicine for all who are sick, a vase of plenty, a tree of miracles. And for the boundless multitudes of living beings, may I bring sustenance and awakening, enduring like the earth and sky, until all beings are freed from sorrow and all are awakened. Namaste, everyone. Be well.
That's very beautiful. Thank you so much. Ladies, it's Carol Laurie. It's Breast Cancer Awareness Month. So there will be a lot more. And I know it's not a 1 month moment for you. That's why I'm here to support you all the time, as is Dr. Mary Elaine. Have a lovely day, everyone. And there'll be more later. Thank you all for being here.